Flu is certainly a serious disease, and it can put you in the hospital or even worse.
Yeah, the flu vaccine can help keep you healthy and can keep you out of the hospital so COVID-19 patients can be treated.
Yeah, and here to explain more about the flu vaccine is Mick Bolduc. He's an epidemiologist and vaccine coordinator for the Connecticut Immunization Program. Thank you for being here. It's even more important that we get the flu vaccine this year, right?
It is, Kara. Thanks for having me on today. And yes, this year, more than ever, it is very important to get the flu vaccine. As Scott mentioned, we want to keep people out of the hospital. We're seeing that second surge of COVID patients in the hospital. So we want to keep people out of the hospital, keep those beds available for COVID patients. And the best way to do that is have people get the flu vaccine. The flu is a preventable disease, and far too often, people are not getting the flu vaccine. On average, we only have about 50% of people in the United States getting a flu vaccine on a yearly basis, and that's just not good enough.
Then it's January 4th already, and people are probably thinking, oh, it's too late for me to get the flu shot. Is that not, that's not the case, right?
It's not the case, Scott. It's not too late to get the flu vaccine. Flu goes all throughout the winter. We actually don't see a peak usually until February or even into March. We see cases into April or even into May. So if people haven't taken advantage of getting the flu vaccine, there's still plenty of time. They can go to any location throughout the state that's still offering the flu vaccine. There's plenty of available locations. They can actually go on to vaccinefinder.org. They can punch in their zip code, and they can find a place that is within 5 or 10 miles of their home, and they can get a low cost or no cost vaccine, and they can get it today.
And the State Department of Health really is advocating that everyone out there who's over the age of 6 months old, get this vaccine. I was very grateful that when I had COVID recently, that I knew I'd already had the flu vaccine. It made me feel like, okay, at least I'm not double compromised. But as we go through a pandemic, not having the flu vaccine creates even extra complications, right?
It does. You want to protect yourself as you can. As we know, the COVID vaccine is rolling out now, but we're in phase 1A of that. So not everyone is eligible to get the COVID vaccine. But what you can do is you can get the flu vaccine. And as you mentioned, Kara, it's available right now for everyone 6 months of age and older. But far too often, people aren't taking advantage of that. We do a good job of getting children vaccinated, and the elderly, 65 and older, do a good job of getting vaccinated. It's that 18 to 64-year-old population that really doesn't do a good job of getting the flu vaccine. And we're really doing a campaign to try and change that this year, both in Connecticut and nationally. And we want those people to understand that the flu can put you in the hospital, and in severe cases, it can kill you. So it's not just a bad cold. It really is a serious illness that people need to take seriously.
And are there differences between the symptoms of flu and COVID for people out there who are wondering, what do I have?
Yeah, I mean, a lot of times people with the flu are just going to think it's a bad cold, but you're going to get the aches, you're going to get the chills, you're going to get the fever. And it can mimic COVID. So, what we want people to do is get a flu shot, because if you get the flu shot, it's going to help prevent you from getting the flu. And with COVID, and what we want people to understand is anytime you're sick, don't take a chance. You want to contact your healthcare provider anytime you're feeling these sort of symptoms. Don't take a chance. Call a healthcare professional and get treated. But with the best thing you can do for you and to protect yourself and protect your loved ones is get an annual flu shot. That's the message that we want people to understand right now.
Yeah.
Is if you haven't had a flu shot yet, there is time. There is an opportunity for you to go out and get that right now. Don't wait. Capitalize on the opportunity. We have this window right now. Go ahead and get a flu shot.
Yeah, I feel like this year we've been saying it even more. And have you noticed, at least in Connecticut, are more people getting a flu vaccine this year than in normal years?
Well, we don't have the data just yet to support that. We're hoping that our constant messaging is helping with that, and we won't really know for a little while longer. The preliminary data suggests that it really is about the same as in previous seasons, which is about 50%, but we won't really know for another month or so if those numbers are better than last year.
One quick question, because I know we're running out of time.
The good news is that we have time for people to go ahead and get that flu shot.
just yes or no, one quick question before we let you go. If you're signed up to get the vaccine for COVID, maybe you're elderly and you can get it, and you haven't gotten the flu shot, can you get them both close together? Is that okay? Can you still get both?
You absolutely can. Great question. You can certainly get them close together. We're still in that phase 1A where healthcare providers and emergency responders and long-term care facilities are right now getting COVID vaccine. We'll have a decision soon on the next phase for COVID. But right now, everyone 6 months of age and older can get that flu vaccine, so don't wait while it's available.
All right. Well, thank you so much. We appreciate your time and all of your advice.
Thank you, guys. Thanks for having me.
Happy New Year.
And
Happy New Year.
Happy New Year. And to set up an appointment for a flu shot, you can visit vaccinefinder.org. Really, it's very easy to get a flu shot. They have them at lots of the local drugstores or your local provider.
Yeah, and they're asking if you post anything on social media about the flu vaccine, be sure to use the hashtag FightFluCT.